Immunodeficiencies seem really annoying, but once you do a couple of questions on them, they become really easy. A 6-month-old male infant presents to his pediatrician with his second episode of pneumonia in the last 3 months. His mother reports that he was healthy for the first 4 months of life, but has since had recurrent URIs and 2 bouts of community-acquired pneumonia caused by strep pneumo. On exam, lymph nodes are not palpable in the neck or axilla. Labs show a super low IgG, super low IgM, and low IgA. Flow cytometry shows adequate CD4 and CD8 and markedly decreased CD19 and CD20. For this test, what I need you to know is that anything less than CD10 is going to be T cell related, and anything CD19 or 20 or around that range is going to be B cell related. So this patient has really, really low B cells, but his T cells are totally fine. Which of the following best explains this patient's immunodeficiency? All right, defective IL-2 receptor. This is going after severe combined immunodeficiency or SCID. And they have one other thing they could have as an answer choice for SCID, and that's going to be adenosine deaminase deficiency. Both of those are interchangeable. You need to know that for the test. SCID is going to be a super sick baby who's getting recurrent viral, bacterial, everything infections. Their T cell count and their B cell count are in the toilet, and they get recurrent opportunistic infections. These kids can't get live attenuated vaccines without killing them, and pretty much the only way they can survive is with a bone marrow transplant. This patient has totally normal T cells, making this answer wrong. All right, CD40 ligand deficiency. This is going after what? Hyper-IgM syndrome, which is essentially going to be a patient with recurrent opportunistic infections, and they're just going to mention that his IgM is through the roof and all the other immunoglobulins are low. This patient's IgM is low, making this answer incorrect. All right, Bruton's tyrosine kinase mutation, also known as Bruton's agammaglobulinemia, and CVID. People get this wrong all the time on the test. I'm going to make this very simple for you. Bruton's agammaglobulinemia is going to be in a baby, whereas CVID is going to be not in a baby. They can have them in younger people, but it's usually after puberty, so roughly 20 to 40s, but they totally can have it in a younger person. But just the main thing is Bruton's is always going to be a baby. CVID is not going to be a baby. The main problem with Bruton's is that we cannot form mature B cells. So our B cell count is going to be absent or nearly absent, and we can't make plasma cells also, meaning that our immunoglobulins are low. These patients are super sick, and they're going to present with pneumonia and URIs very early on in life, just like this patient. And these patients need to be treated with IV immunoglobulin and prophylactic antibiotics to survive. So when you see normal T cell count, super low B cell count, and low immunoglobulins, I want you to think of Bruton's agammaglobulinemia. Whereas CVID, not a baby. The main problem is that we can't convert into plasma cells. Our B cells are totally normal in CVID, meaning we would not have markedly decreased CD19, CD20 cells. But what we won't have is plasma cells. And remember, plasma cells are the ones that make immunoglobulins. So if they give you an arrows question, B cell and T cells are going to be totally normal, but all immunoglobulins are going to be really low. In some basic immuno, I want you to know there are 3 things that can happen to people who have B cell issues. Do you know what they are? And if you've watched Pathoma, you'll probably recognize this. It's going to be recurrent bacterial, enterovirus, and Giardia infections. Whereas any T cell issue is going to be fungal and viral. All right, let's go over the last incorrect answer choice, WASP mutation. This is going after Wiskott-Aldrich. This shows up on every freaking test, I swear to God. It'll show up on your step 1, all of your shelf exams, and step 2, and probably going to be on step 3. And what you need to know about this is going to be a person who gets a bunch of pyogenic infections, and they're going to have really gross skin, like really nasty eczema stuff, along with really low platelet counts. Answer is C.